All right. So, what we're going to talk about now is why it seems like we aren't recovering from concussions. And this little study here demonstrates this pretty nicely. This is a story about some mice, and we're mainly going to be looking at the circles versus the black squares. Now, I'll explain something down along the bottom. This is a time scale here, and this is a neurological functioning. So when things go down here a little bit, you'll see they aren't doing so well. So the mice are having headaches or dizzy or their balance is off. They've got ways of measuring these kind of things. These are concussions up here, and as I've talked about, you can have a physical, traumatic type of concussion, like you might get in slipping on the ice or a car wreck or things like that. You could get an emotional or non-traumatic one. This would be, like dying of a broken heart syndrome. And then you can have inflammatory, which are concussions or concussion-like effects that are from, in this case, was from vaccine injury, but it can be from just the effects of chemotherapy, for instance, could do this. And so what I want to look at here are these white circle here, and this is a healthy mouse. So this mouse is going along, gets hit, whacked in the head by some event, and is you can see deflects down a little bit. He's not doing too well, but at this point his white blood cells in his brain, they're called microglia. The microglia turn on and they fix the brain, and you can see he drifts back up to baseline here. Then he's going on a little further, gets another one, not doing so well, but inflammation turns on and fixes things. Then he's got another one, not doing so well, and then the repair process turns on and he's back to normal. So the point of this is, at this point here, he is the same as when he started. And this is what should happen to us in life, and this is what used to happen to us in life when people are having some hard time understanding this, because we've changed because of a process I'll talk about in a minute. But this should be kind of life. So this is like some high school sports industry, maybe. This is a car wreck at 35. This is a phone call. Your mom suddenly died. All these things are going to cause micro damage to the brain. And micro damage means there's cellular damage. You could see it in a microscope, for instance, but there's nothing to be noted on your standard CAT scan or MRI scan. And we should recover. So all these events kind of will take us long, and by the end we would eventually recover of all these things, and we would be as good after it as we were before, at least in terms of neurological functioning. But what's happening is we're kind of like the black square mouse. Now the difference here is this mouse basically had SIBO, that imbalance of gut bacteria, for 1 day 3 months ago. That's why it starts down here at week 12. Okay, so 1 day 3 months ago, and this seems to now permanently change how our white blood cells work in our brain. They should live for just a few days and then be replaced. And what's happening is one of the things is they don't die. They are immortal at this point. And when they turn on, they're turning on in a different way, and they seem to be adding to the damage in the brain versus repairing it. And that's kind of what you see here. So you got same mice, same impact. Only difference is one day of SIBO, and you go along, this black square mouse, he gets hit, and boom, much worse. You see the difference there. Okay, much worse. Whoops. But the brain restore mechanisms kick in and partially recover. You see right here, he's not quite as well as he is up there. And he goes along, gets a similar impact, but because the brain's already weakened and these white blood cells have not turned off, and they keep spewing out this inflammatory material that we call pro-inflammatory cytokines, the second impact is much worse effect on the mouse, and almost no recovery here. Then the third one is catastrophic. I think what you're hearing about with football players doing worse, professional football players and athletes who have multiple repeated injuries, they're way down here. They're going down this slope. And so that's the problem, where most of us are like this. And so if you look at somebody's autonomic tests like this, Here, this is on the stand portion. You can see this person's got damage here on the sympathetic. This is one of the most common things we see in a traumatic injury to the head, and people have trouble getting blood pressure to their brain, and it makes them, they can't focus, they can't concentrate, they can be anxious, they can make them fidgety, it makes them crave salt or sugar, it makes them addicted to nicotine, and this person didn't recover. It was 30 years ago. Okay, now this could be an okay test if, well, it didn't recover, it was 30 years ago, and so the person's right here. They should have recovered. They should have been the white mouse, so they get injured and they get better. Okay, but they didn't. Now this would be okay if potentially this was, say, a different scenario. This is somebody who had a car wreck a month ago and they got these symptoms. I would see that, because then what you would expect to see, and this is the very same person after we repaired their brains, but what you would expect to see naturally occurring is, you see that bar came all the way up to normal. Here, I'll show you again. Here it's down low. Okay, this is after 30 years, and then we had to repair it. But naturally, that could have been 1 month after a car wreck, and if the brain's working correctly, within 2 or 3 months you would be repaired like that, and the symptoms would all be gone. But that's not what's happening. That's because this person had SIBO, that case I was just telling you, and their white blood cells weren't working, they wouldn't shut off, and the patient was stuck here, basically. Now, fortunately, the things we're doing, the high-dose DHA and the vagal nerve stimulation, they drive up, they suppress that inflammation and the repair mechanisms, and will allow you to recover back to normal. And now, we've had a number of patients prove this over and over again, kind of the hard way. I think almost everybody has to do it once, is they quit doing their vagal nerve stimulation, they cut back on their DHA, and what happens is these white blood cells, these abnormal ones, they're called microglia, they fire up and they become, they turn back on without that high dose of DHA, and things get worse, and they actually are this little triangle mouse here. I didn't mention this. This is a mouse that had SIBO but doesn't get the concussions. So just the white blood cells themselves, just they alone without the concussions, and these abnormal white blood cells will add to the damage. So even though I can take somebody from here, we drive them up with DHA and vagal stimulation, if they stop doing that stuff, they become the triangle mouse and they deteriorate again. Now, how long are we going to have to, what's it going to take to flip this around? Well, that's just the next target for us to fix. We don't know yet at this point. It could be a couple years, it could be 10 years, it could be 5 years. We have absolutely no way of knowing. But at least right now, the good news is we can take people with this permanent kind of brain damage and get them to recover. And I should add, this kind of damage here that's preventing this mouse from recovering and that prevented this person from recovering here on this test is the exact same phenomena that prevents people from recovering from episodes that cause them to become depressed or develop post-traumatic stress disorder. The very same thing. And once you treat these white blood cells again in the brain with the DHA and the vagal nerve stimulation, they come back up to normal.